Hi, my name is Courtney Waxman, and I will be answering the most frequently asked questions I receive as a veterinary nurse specialist in emergency and critical care. Our first question is, what does a typical shift look like for an emergency or critical care veterinary nurse? This was a little hard to answer, but it's also exciting to answer. So the typical shift is really, we don't know. That is the nature of emergency and critical care medicine. We don't have a set schedule. Anything and everything can walk through that door that may require veterinary medical care. So typically, we're going to have an unscheduled visits, a lot of emergency visits. Generally, in the practices that I've worked for and that I have worked with, the kind of roles that are designated for the veterinary nursing team are someone performing triage for all of those incoming emergencies that we see, teams that are taking care of outpatients, so patients that have emergencies, but maybe they don't require long-term or hospitalization care. And then teams that are working with those hospitalized patients in either an ICU setting or just a hospitalization setting that have some sort of emergent or critical illness that requires longer term care. But the shift itself is going to be unpredictable, which is also exciting because the nature of emergency is we don't know what to expect. Our next question is, what types of cases do you most frequently provide care for working in emergency and critical care medicine as a veterinary nurse? These vary a lot as well. Again, anything can come through the door. Typical presentations are things like vomiting and diarrhea or GI distress. We get cases that are respiratory distress that have suffered some sort of trauma, whether that be from car accidents or falling from heights or other animal type attacks. We see a lot of cases that have severe systemic illness like heat stroke or sepsis, anaphylaxis. Those are some really key emergency things, as well as toxicology or toxin ingestion or potential accidental poisonings. Really, the sky is the limit of what type of cases we see care for, but anything walking through the door is going to receive that emergency level of care. Our last question is, what is a clinical skill that is often used in the emergency and critical care medical setting that would be helpful for veterinary technicians or nurses to know? This one is an easy and a no-brainer for me. It's CPR. The sad truth is that because we are working in emergency and critical care medicine, our patient population is at higher risk of an arrest. They are suffering from severe systemic debilitating illnesses that may result in the animal arresting. And so being prepared to provide cardiopulmonary resuscitation or CPR is really important to improve possible patient outcomes. So being trained on the most current and up-to-date practices of CPR, which in veterinary medicine is from the Recover Guidelines or the Reassessment Campaign on Veterinary Resuscitation, so that you know what it takes to be able to provide both basic and advanced life support care as part of your CPR efforts. And those are the 3 most frequently asked questions I receive as a veterinary nurse specialist in emergency and critical care. Thank you for watching.